Hello and thank you for downloading another edition of NACCHO's podcast series. Today I'm joined by Todd Park, Chief Technology Officer for the Department of Health and Human Services. Todd Park joined Health and Human Services in August of 2009, and prior to joining the Department of Health and Human Services, Mr. Park co-founded Athena Health, a company focused on health information technology. Thanks for joining us today.
Thanks for having me over.
What one or two steps would you recommend to local and state public health departments that wish to improve data sharing through public-private partnerships?
I would say that to start simple. So I think that it's easy to, when one gets into the whole zone of data sharing, to begin to try to boil the entire ocean all at once, which I think is very understandable, but is clearly not the place to start. So I would say, look, what data do we have, and do a quick inventory, and then say, well, what data here would be most useful in the cause of advancing public health and health improvement in general in my community and across communities. And then I would take those initial data sets and I would publish them in whatever way you can get them to market, if you will, fastest. I mean, if it's just an Excel spreadsheet, fine. Put out an Excel spreadsheet, post it on the website, and then work with people like us to get the word out that you've just published new public health stats for your community, or that you published new hospital quality metrics for your community. Us and other channels to publicize that. So through our Health Data Initiative, HHS and our partners are encouraging the opening of data across the country. And we have a whole series of channels through which we can broadcast new data sources so innovators know that they're there and can pick them up. So I would say, again, keep it simple, figure out what initial data sets you can put out there that have the biggest marginal return socially, and then just get them out there via any means necessary, and then get in touch with people like us to help publicize the fact that you put them out there.
What has been learned from the Department of Health and Human Services' embrace of innovative e-technologies that might be helpful for local and state public health departments to know as they seek to embrace innovative technologies themselves?
I think the most important lesson is Bill Joy's old saying, see to some systems that, no matter who you are, you have to remember that most of the smart people in the world don't work for you. And that actually the way, I think, for public health departments to leverage innovative technology to improve health is not necessarily for them to do it themselves, but for them to help weaponize, fuel, catalyze the harnessing of innovative technology by lots of other smart people who have lots of complementary resources and capabilities to leverage those kinds of technologies to improve health. And so the Health Data Initiative is a classic example of that, right? So where HHS and our partners are publishing a whole bunch of data in forms that are really usable by developers, growing amounts over time, and then promoting the existence of those resources. And then a whole bunch of innovators outside HHS are leveraging their platforms and capabilities and services to harness that data to produce all kinds of innovative tools and services that help consumers, patients, communities, journalists, employers, doctors, hospitals, et cetera. So I think the notion of jujitsu, the notion of leveraging all the other smart people in the world who can wield these technologies for good is I think the kind of mindset that's important to have.
Mm-hmm. And you've helped address challenges of data sharing efforts across the federal government. And what are the one or two steps you'd recommend for local health departments that wish to get data from their state or federal partners?
Well, from the federal government, we made it a lot easier by creating a site, healthdata.gov, that is the one-stop shop for all of our free data and APIs. And so what we found is that there are resources that we have made available in the past that people don't know about. The resources that we've made available recently that are actually hard to find. And so by creating this one-stop site, healthdata.gov, we've made it a lot easier for people to find all the stuff that we have had available for some time, and actually all the stuff that we're making available in growing quantities now. And so it's a comprehensive catalog that you can go to as a locality, as a public health department, to find an incredible arsenal of stuff, of data sets that can be useful to you in all kinds of ways.
Mm-hmm. And what might the roles of health information exchange and public health in assuring the quality of clinical care?
I think they're fundamental, right? So health information exchange is absolutely fundamental to improving the quality of care in a world where you have to coordinate care across multiple providers in a whole lot of cases to help people get better and to help ensure that people stay as healthy as possible. It's actually incredibly hard to imagine how we would easily improve the quality of care, improve health outcomes if we don't actually have a coordinated flow of health information exchange. And then in terms of public health, I think one of the things that's going to happen is there's historically been this very weird divide, right, between the healthcare system and the public health system, like they're two parallel universes, which doesn't make any sense. I think that divide is going to start to come down as, for example, the Affordable Care Act, Health Reform Law, begins to change the payment systems for Medicare and Medicaid, and private sector companies are doing the same thing, to actually pay for health, as opposed to just paying fee-for-service and paying for volume of services. We're moving to pay for health, right? And if you're now actually, as a medical home or an accountable care organization or a bundled care rate team, accountable for the health of the population, right, it takes you about 17 seconds to realize that there is a bunch of stuff that impacts the health of the population. That's not what happens within the walls of your hospital or your doctor's office. And so you have to become involved in population health management, which actually then, I think, seamlessly integrates with the world of public health, right? And so I think that there's going to be a set of wonderful opportunities for public health leaders and for healthcare leaders to team up, to work together on population health management in their community, in a world where the healthcare system is actually funded and incented financially to do that, and where technology makes it increasingly possible to integrate those efforts in all kinds of ways.
Is there a timeline for implementation
of
these types of online information exchanges? And
yes, I mean there's a whole bunch of effort across the country right now to implement exchanges.
But no actual by 2020 we hope to have X and Y completed in certain phases or anything like that.
I think it's more organic than that. Mm-hmm. So. And I would actually, also say that health information exchange isn't a noun; it's a verb, right? So, and there's a lot of progress being made on implementing the ability to execute the action of the verb. So, for example, there was a project last year, a really brilliant public-private partnership that came together to define an easy way for doctors and pharmacies and labs to send each other information securely from point A to point B. And it was called the Direct Project. It came up with something called the Direct Protocol, which is secure healthcare email. And something like 70 different EHR vendors that represent over 95% of the installed EHR base of America have committed now to implement the Direct Protocol, I think this year. There are a whole bunch of other efforts to build what are called trusted affinity networks that allow for kind of rich bidirectional information sharing, a bunch of which either already exist or have actually gotten going in some meaningful way to enable at least some base level transactions to happen. There is a growing movement toward consumer-mediated information exchange, where consumers are able to download their own information and then actually essentially bring it wherever they want. And I think that all three of these different methodologies, direct exchange, trusted affinity networks, and consumer media exchange, are all going to be important and necessary, and they're all happening, with increasing speed and impact. And I think that again, as payment incentives change and as providers become rewarded for keeping people healthy, right, that will just accelerate this whole trend of growing information exchange, because you're going to need to do this. You're going to need to do good information exchange in order to ensure that your patients are in good health and stay that way.
For the average American patient, how hard do you think this is going to be for them to use this type of technology, as far as receiving the information from their doctors? I mean, what kind of campaign is there to implement this on the patient side for the average American that doesn't really know how to access medical records and stuff like that?
Well, there's a whole bunch of work that's happening to help consumers access their own information. And so a great example of that is the Blue Button Project, where the Veterans Administration, Department of Defense, and Medicare launched last October the ability for any Medicare beneficiary or any veteran, any member of the military, to download a copy of their own personal health information in a human-readable file. And so for Medicare, it's your own claims information. For the VA and DoD, since they run their own healthcare systems, it's your personal health record. The VA projected before we launched it that if we just blew the doors off the thing, 25,000 veterans would download their information. Because they had this question: well, how much do people really want their information? Do they know what to do with it? But to date, with zero marketing, over 400,000 Americans have downloaded their own data, over 1 million times each. We just actually captured some video from veterans who are describing how they're using it. They absolutely do know how to use our information, right? They actually have a printout which has their 14 meds that they're on, and when they go from doctor to doctor to doctor, which a lot of them do, because they're being cared for multiple conditions simultaneously, instead of having to remember which of the 14 medications they're on, or basically tell this doc when the last time they saw a doctor was and what happened, they just show them the piece of paper. So it's very commonsensical. I think that, and by the way, so Aetna has agreed to blue button its personal health record. Patients like me, Walgreens, there'll be upcoming announcements from more private sector organizations that are blue buttoning their data. And it's not the end-all be-all in terms of the answer, right? But it's a very encouraging experience with respect to consumers actually having an appetite for and then putting to good use their own information.
Mr. Park, thank you so much for joining us today. I appreciate it.
Thanks so much.
You've just heard from Todd Park, Chief Technology Officer for the Department of Health and Human Services. We hope you've enjoyed this edition of the NACCHO Podcasts. For more information or more podcasts, please visit our website at nacho.org.